Well, I'd like to introduce our guest today, Dr. Julie Sieben. How are you, Julie?
Doing well. How are you, Paul? Thank you for having me.
Thanks for being here. Julie, can you tell everybody how you got into chiropractic and what does chiropractic mean to you?
Sure. I was a gymnast. At age 13, I herniated 2 discs in my back, so I had a pretty bad injury, sort of over time, and then a particularly bad fall, and that's how I got introduced to my chiropractor and chiropractic care in general. So that was my first exposure to chiropractic. And through chiropractic and yoga and physical therapy and just getting in better shape with my back, improving my back health, my core strength, I was able to heal my back. And so chiropractic was always kind of in the back of my mind as an interesting career choice for me. I went to undergraduate school for exercise science from UMass Boston and worked in that industry and continue to work in that industry until about age 27, 28. And at that time, I felt that I had done what I wanted to do in the fitness industry alone. And I knew I wanted to learn more and help people in a different way and expand my knowledge base. So I kind of juggled with going to traditional medical school or going to chiropractic school in my late 20s. And because of my good experience with chiropractic and my chiropractor, I decided chiropractic school made more sense because chiropractic is more of an alternative approach. Sure. I would say alternative, more of a natural approach to health and healing, and that was more in line with my philosophy.
That's who you are, yeah.
Yeah, so I decided to go to chiropractic school then, and that was the reason for my choice. But I think my initial injury is what sort of opened the door to fitness and wellness and chiropractic.
Do you have a non-scientific guess as to how many chiropractors would say something similar to that? I feel like I know I have some friends who are chiropractors who were drawn to it for the same reason.
Yeah, I would say, many of my classmates had similar stories. They either had a good experience with their chiropractor or had an injury, and certainly I'm not alone being a chiropractor who was also involved or interested in fitness. I work as a personal trainer, and I know several chiropractors who have a similar background with the exercise science degree. And yeah,
okay.
Yep.
So how long have you been in practice, and if you wouldn't mind, share a favorite experience of your practice with us?
Sure. I graduated chiropractic school in November 2010, so I've been in practice for about 2 years, and also did a 1-year residency at VA Hospital in upstate New York as part of my schooling. So that was pretty neat. So I've been treating patients for about 3 years now and have been in this area in Plymouth for about a little over a year. I also practice in Washington, D.C. before I moved back home, which is Massachusetts. I think some of my favorite experiences with chiropractic are simply people who don't know a lot about chiropractic and they're afraid of chiropractic and they are at their last straw with chronic neck or back pain and they figure, what the heck, I'll try a chiropractor. Yeah. And in 1 or 2 visits, they say to me, I wish I had done this about a decade ago, if not longer. Yeah. So that's always very rewarding. I think those are my best experiences.
Okay. What are some of the common reasons for back pain? That's the topic of the day, so let's dive right in.
Yeah, the most common reason for back pain usually has something to do with weakness in your core musculature, including your abdominals, your back, your erector spinae, your hips, and also lack of flexibility in key areas like your hip flexors and your hamstrings and the back, again, the erector spinae. Most back pain is not a result of some traumatic injury or fall. Usually it's cumulative trauma over time, improper lifting, improper body mechanics, improper sitting, sleeping. Yeah. Obesity is a contributing factor. So most chronic back pain actually has to do with choices we make on a daily basis in our lifestyle.
As part of the opening, I did not let Dr. Sieben see the opening be shot, nor did she see the script, and so I do this for me as a learning experience.
Sure.
And the beautiful thing is you nailed it.
Nice, nice.
So thank you.
You're welcome.
How do you? I know that you also do yoga. Is that correct? And
I do. Yeah.
And so, how'd you get into yoga? And say a little bit about how yoga can help with back pain.
Sure. Well, I got into yoga after my back injury. I know my aunt bought me my first yoga video, and it was Lila, if anybody remembers Lila. She wore the unitard, and I used to do yoga at home with that video. So that's how I got exposed to yoga, and it was part of rehabbing my back injury. So I became a yoga instructor probably in my early 20s. I was trained with Yoga Fit, which is a company that trains yoga instructors who are more involved in the fitness industry as opposed to studio trained yoga instructors. But in any event, they do a great job. I teach an athletic style yoga, and yoga can help with chronic back pain because it helps strengthen the core and stretch the muscles that are commonly tight and contributing factors.
Okay. The next question was going to be about different types of yoga. I'm going to combine a question that you just provided for me, because I would like a little bit more said about the difference between studio and fitness yoga. But then if you would, because I suspect that there's people who've heard of yoga, maybe even the name Hatha or whatever. Can you elaborate on the differences between studio and fitness yoga, and then maybe talk about some of the different names so that maybe somebody who's thinking about yoga might help them make a choice?
Sure. I think it depends on your reason for taking yoga, first of all. So yoga is a discipline that comes from India, and the whole purpose of the development of yoga in that system over 2,000 years ago was to prepare the body and the mind for sitting in meditation for many, many hours. So the yoga postures or the asanas were developed to help clear the mind and prepare the body to sit and meditate and find nirvana or samadhi. But in the West, that's not typically what we're going for. We're looking for a killer workout.
I don't know. I think I could use a little nirvana. I know that.
Okay. So a lot of the way we practice in the West is more taking the physical discipline and not so much of the spiritual discipline, I suppose. And I'm not speaking for everybody, but a lot of people are seeking yoga in that way, to get strong and to get flexible, and certainly for stress release and relaxation, but not necessarily to sit in meditation for 2 hours. So, I was trained to teach sort of in gyms. So my yoga training is less philosophical, less spiritual, and the type of class I teach, we don't om. Not that, not that I'm against that at all. I like that. That's just not the style practice I teach. Now, if you think more of a traditionally studio-trained yoga instructor, they're getting a little bit more of the philosophy, a little bit more of the spiritual
breath work
practice.
And some of the spiritual aspects of it?
Yeah, I'd say even more just the spiritual practice.
Okay.
And certainly in the class I teach, the breath work is an important component of the physical practice.
Okay, so you do address breath.
Yep, I do address breath work for me. We do the physical postures, and I always do like a 10-minute meditation or final relaxation at the end.
So they're not escaping the spiritual components of it. It's just
not the focus.
Didn't mean to use the word escape. I don't know why that's Freudian slip.
Run.
Yes, and so well, it's. I think the reason I was saying this because every time I talk to somebody about meditation, I just see this kind of glazed over look.
I actually teach meditation